Okay, so tell us a little history about your jaw problem, your joint problem.
Boy, it started probably about a year and a half ago with a plugged ear, and I thought it was because I was traveling back and forth. The plugged ear would not go away, so I went to my, primary care, did all the, you don't have an infection, try this nasal decongestant, did that for a couple of months, and the earplug won't go away. Then I started went to an ENT, went to a dentist, went to an oral surgeon, went to physical therapy, and it was just radiating the pain from the jaw. It started hurting here where I couldn't open my mouth all the way, and so it was TMJ basically. And
Okay.
it wasn't until Muna Strasser and I were talking one day, and she's like, "What's wrong with you? What's wrong with your jaw?" It's like she could see it just in talking to me.
Yeah.
Yeah, she just recognized it. She's like, "Don't go anywhere. Come in. We'll get some pictures taken," which is the scans, and so she was able to look at my jaw in no other way that anybody else did, because it was just like level 5, 6, 7 pain most days.
Yeah.
And since she's been taking care of me, it's varies from anywhere from 2 to 5.
Okay, so you mentioned you had gone to a physical therapist. Did they actually treat you for?
Yep. So she was treating me. She's like, "Oh, you're carrying a lot of stress. Are you clenching your jaw?" And so she did, but she manipulated my jaw, and we think that maybe that had something to do with aggravating.
Taking it the next step.
Yeah.
Okay, and then did you have more pain after the physical therapist?
Yep.
And so you just stopped
I
going
just stopped
there.
going because it was just, and then I went somewhere, when I went to the oral surgeon, they said, "Yeah, you need to go to physical therapy." I'm like, "I'm not going."
Oh,
Because I was scared of them manipulating my jaw even more and causing more issues.
So at that point, then you were kind of at a loss, didn't know what to do, and then Dr. Strasser noticed it. That you were having issues with it.
Yep.
Okay. And so then, how long ago was that you came here?
Oh gosh, it's been over a year probably. It's been probably about a year. So I saw her last January,
Okay. And then how are you doing now since she's treated you?
Much better, because I have this, she was able to, my regular dentist just put a mouth guard in, which wasn't doing anything, but she made me a temporary splint, which I didn't even know there were such things existed.
Right.
But as soon as I started wearing that splint, it relieved the pressure, like at night, and kind of realigned my jaw.
Okay.
And that's what seems to help the most,
Okay.
is that splint that I wear at night.
Okay. And so you've been wearing that splint then like a couple months, or?
It's been since March, maybe, I want to say. It's been quite some time since I've been wearing it.
Okay.
March, April time frame.
Okay.
Actually, sorry, I take that back. It's probably been April, May when she made it for me.
Okay.
Yep.
And you've been doing great since then.
Yep. It's like, what was really nice was Dr. Strasser broke everything down for me. She drew out little drawings to explain what was going on with the joint. When she took the big x-ray, the full round, she showed me where the issues were and why I was feeling the pain that I was feeling. It wasn't like, well, you have TMJ and just move on and you need this or that.
Right.
It was the time that she took to explain what was going on that it made it a little easier to understand and process what was actually happening and why the problem is not just going to go away on its own without treatment.
Okay. Well, that's good. I'm glad to hear that you're doing better.
Yeah.